Welcome to the body imaging cases. This is a case of a 5-year-old male with blunt abdominal trauma. There is free intraperitoneal fluid. If this is not a pre-existing ascites, and it is very rare to have ascites in a boy 5 years old, previously healthy, then we have to think of this intraperitoneal fluid as a rupture of a fluid containing structure in the body, and the best is the urinary bladder. Hemorrhage may also be a possibility due to injury of a solid organ or vascular injury. The fluid is increasing as we go towards the pelvis, and this raises the possibility of urinary bladder rupture. We start to see the ghost of the injured urinary bladder with a defect at its right anterolateral aspect. And at a lower level, the urinary bladder wall forms again a complete ring surrounded by the extravasated urine. Note also the dissection of the extravasated urine between the layers of the bladder wall. Note at this level that some of the fluid is going well inside the right rectus sheath, and it is not possible for intraperitoneal fluid to do that. Extraperitoneal fluid, on the other hand, can do it, especially at this location below the arcuate line of the rectus sheath due to the absence of the aponeurosis of the transversus abdominis. So we conclude from this image that we are dealing also with extraperitoneal urine extravasation. The second location intraperitoneal fluid cannot reach is the space between the urinary bladder and the lowermost part of the anterior abdominal wall and the symphysis pubis. This is the space of retias, and this is also typical for extraperitoneal urine extravasation. The sagittal reconstruction shows the anatomical details and the pathological changes to a better advantage. The blue arrow points to the tear in the urinary bladder. The yellow arrow points to the intraperitoneal fluid. And the red arrow points to the extraperitoneal fluid at the space of retias. The plain X-ray done after the CT shows the excreted contrast agent delineating the liver and the hepatorenal recess. At the pelvis, the contrast agent delineates the urinary bladder wall from inside and from outside. See how it is thick between the green arrows. You see also the orange arrows pointing to the site of the urinary bladder wall tear. So the diagnosis here is intra and extraperitoneal rupture of the urinary bladder. And the learning points are the rectus sheath and the cave of retias are two anatomical locations where intraperitoneal fluid cannot reach. Fluid there is extraperitoneal. Delayed CT is important whenever urinary bladder rupture is suspected. In the present case, the tear was large and could be seen on the early post-contrast CT, and it has been supplemented by an abdominal radiograph that proved the extravasation of urine. But in case of a small urinary tract tear, the delayed contrast-enhanced CT is an essential part of the examination. The next case is a female, a 79-year-old with respiratory failure on mechanical ventilation, and she developed severe abdominal distension.